So we're going to start off this discussion by talking about the experience of diagnosis, really exploring what that moment was like and how important it was for healthcare professionals to communicate appropriately in that time. So Anthony, if we come to you first, can you tell us about what it was like when you were diagnosed? How did that make you feel? And how important was the communication from your healthcare professionals in that moment?
Yeah, well, when I was first diagnosed, it was a bit of a shock when the clinician, I was in the room and he sort of mentioned my results from my PSA test and the biopsy that I had. I think, sorry, not biopsy, my MRI that I had. And he mentioned to me that I had prostate cancer. But I think the thing that gave me a little bit of reassurance from what he said was that the amount of prostate cancer that I had was equivalent to about what 20% of men my age had, but potentially did not develop into anything that was considered to be majorly serious. So I think that gave me some reassurance that my diagnosis was one that was treatable. And I suppose the key thing for me was the actual statement that 20% of men had this, but it didn't actually affect them in a way that would actually impact on their lives. So I think him actually saying that gave me the reassurance that I was in good hands and this could be treated. But at the same time, there was a little bit of anxiety, but I think it was perhaps watered down a bit by the reassurance that it was 20% of men had this. They didn't go on to develop anything major. So from my point of view, despite the fact that I was a man in my sort of late 50s then, I still felt assured that the prognosis was a good one.
Thanks, Anthony. It's great to hear that you were able to draw that reassurance from your clinician being really informed around those facts and figures. That's really good to hear. Robin, if I come to you, what was it like for you when you were diagnosed, and what was the communication from your healthcare team like?
As with Anthony, it came as a shock. Clearly, for a 61-year-old man to hear that you have cancer, the idea of a death or unpleasant treatment comes to mind. So I was very stressed when I heard it originally. However, I was assured by my oncologist that there were suitable treatments, and what's more, that something like 90% of men who had this localized cancer, low-risk cancer, would survive.
That's great. Thank you, Robin. So again, you're kind of referencing there the importance of statistics, facts and figures that gave you both a lot of reassurance. Both of you mentioned, of course, the shocking effect of hearing that word cancer. And aside from facts and figures, obviously we know that the language and the words used to describe a diagnosis and to describe the severity of cancer are also really important. Just coming back to you, Anthony, what kind of language was your healthcare professional using at that time, and how did that make you feel?
Well, I think the thing that gave me a little bit of reassurance was prior to actually getting the confirmation, he did say to me that until the government had changed the guidelines, I wouldn't have actually been a patient that he would have seen, because I think the guidelines had been changed in terms of what the PSA levels were for someone either proceeding to have an MRI or a biopsy. So once he had explained that those guidelines had been changed and that actually I had come in at a very low level, and then when he actually told me that I had the prostate cancer, I think there was a little bit of an element of both the shock that I've previously mentioned, but also just the sort of next step, what was going to happen. And I think because he was quite clear and reassuring at the time, if I'm really honest, in terms of the options that were available to me, but not just the options in terms of treatment, but sort of saying to me that many men who had this low level of cancer that I had, that actually most men went on to sort of not be impacted and were able to live a normal sort of lifestyle. Those words, those reassuring words, really sort of left me feeling quite confident that actually this was something that I could treat or was treatable. It wasn't going to impact on me severely. And I suppose in a way, if those words of reassurance that I got, that 20% of men, it's always stuck with me. 20% of men had what I had, really gave me the feeling that actually this wasn't going to be something that was going to majorly impact my life, albeit I knew that things would change going forward and that I'd need to sort of monitor things in terms of what I did next. So his words were reassuring. I think if I didn't have those sort of words at the time, if they had been different, if he had rephrased it differently and said, I'm sorry to hear that you've got prostate cancer, but it can be treatable. Maybe if he'd have phrased it that way, I might have been more worried, but he didn't. He phrased it in a way that gave me a reassurance, and I think I took that forward, and I always use that as my reference point that I'd get better.
Thank you, Anthony. And Robin, how about for you? What sort of language did you find was particularly helpful, or maybe not helpful in that moment?
Well, as I mentioned, I think the fact that it came to me as a shock initially, but I was reassured by the fact that I was told that it was localized and low risk, and that because of that, there was every chance of treating it, and that my risk of death or serious illness was low.
Fantastic, thank you. And just finally, talking about this kind of diagnosis stage, it's really important, we often say, for clinicians to back up that verbal communication with either printed or online information or further kind of information and support resources. So again, just going in the same order, coming back to you, Anthony, was there any kind of printed information or online resources that were provided to you at the time of diagnosis? And if not, would that have been beneficial for you, do you think?
Yeah, I think, to be honest, what happened afterwards, I think at that moment in time, you're probably given, and I was probably given some information, but because of the shock and because you're sort of in that moment of being slightly numb, you listen to things and you take away the things that perhaps give you the reassurance, like the 20% of men. But the information that I was perhaps given at the time, if I'm really honest, I don't remember that much of it. I think what I did was I went home and suddenly Googled what 3+3 meant, what PSA levels meant. My wife happened to be a urologist nurse, so she obviously was able to explain some of the things in terms of the language that I may have been told at the time, but I had perhaps forgotten, because in that moment there's a lot of things running through your mind, and you don't always take everything on. So I'm pretty sure I was given literature to review and to read, but I think the main thing I did was to Google up what PSA levels meant in terms of the level that I was given, and what the sort of options were going forward. So yes, I probably was given some material at the time, but I think your whole position in terms of where you are at that particular stage, when you're told that, goes a bit blank, and all you're thinking about is, right, what do I now do next? And the material and things like that sort of go out the window, apart from that 20% of men have the condition, and that for me, it was I was in a good place.
Thank you, Anthony. And Robin, how about you? Is there anything that sticks in your mind as something really helpful that was given to you at the time, or anything maybe that you wish you had had that you didn't?
Well, what Anthony says about being numb is a very important point. I was with my wife at the time when I had the diagnosis, so she was able to absorb a lot of what was said. I do, just like with Anthony, I did do research on the internet, and also I believe I probably did receive some minimal information, written information.
Thank you both. I'm going to move on now to talk about treatment decision making and follow-up. And I think there are some similarities in terms of what you've said so far about the moment of diagnosis, but then potentially things start to look a little bit different in terms of that treatment decision making part of the pathway. So Robin, perhaps if I come back to you first, when it came to that treatment decision making point, what other treatments apart from active surveillance were kind of mentioned to you at the time, and kind of what were your healthcare team or your doctor and nurse saying to you that assured you that active surveillance was the right option for you?
It's interesting because my diagnosis was given by a urologist, a surgeon, and he was very keen on surgery, which would have been a radical prostatectomy by robotic means. I was concerned about this. He did mention other options, but in a lesser way. I had done some research. I saw that on the internet that there were some quite severe side effects. So I decided to take a second opinion. And the second opinion, again, I had the options put to me, but I was told that because I was low risk, because my cancer was entirely localized, that I would be a good candidate for active surveillance. The information I was given was very good. This was at the Royal Marsden Hospital. They had been doing studies on active surveillance for some 14 years, and I was told that they had not lost a single patient. So this was extremely encouraging, and probably was the basis on which I went forward, because I would realize that I would not be having any treatment which would interfere with my career. I would also be finding that if there was a problem, that the issue would be dealt with promptly in first-class hospital.
Thank you, Robin. Anthony, how about for you? At that moment of treatment decision-making, or at that stage of treatment decision-making, what was mentioned to you alongside active surveillance, and what was it, I guess, that made you choose active surveillance, and how was it that the doctors were communicating that helped you to make that decision?
Well, again, I think because mine was low level, and because the consultant said to me that 20% of men had this condition or this disease, he felt that the best option was for me to go on active surveillance, and he explained what that meant in terms of being monitored regularly, for me to have regular PSA tests, to have follow-ups at the hospital as and when, in terms of coming in to see him, to review the results, etc. And I think by him sort of giving me that reassurance and explaining to me what was involved in active surveillance, he didn't at the time mention to me that there was any need to have any immediate invasive treatment such as surgery, because the condition was actually quite low. But he did say that in order to monitor and to check and make sure that things didn't progress, it would be advisable that I'd be an ideal candidate for active surveillance and the sort of steps that would be needed for me to follow. So I think that reassurance in terms of how he explained it, what was going to happen in terms of, the stages of active surveillance, the PSA tests, seeing various consultants, coming into actually the hospital to review, and that I would be notified by the hospital, etc. All of those things gave me reassurance. Plus, again, like Robin, and as I mentioned before, I did also then do some research on active surveillance. And I think actually from memory now, I do remember being given the, information about active surveillance on a leaflet. But again, because everything is so new, you're hearing these things at the time, you don't digest everything immediately, and you're trying to actually sort of, in a way, comprehend what these terminologies are that you're hearing for the first time. Active surveillance, well, what does that really mean? So, again, afterwards, when I got home, I sort of Googled active surveillance, spoke to my wife, and sort of done some more research just to sort of reassure myself what it was I was now going to be under, and what sort of outcomes people had from actually being on that service.
Thank you, Anthony. That's really interesting to hear that you drew a lot of reassurance from a certain level of detail that was given to you around the kind of follow-up protocol. So actually knowing that you were going to be in hospital periodically, knowing that you would be under the care of a healthcare team and in the system, actually gave you that reassurance that this is a specific treatment pathway and not just a decision to do nothing. Just kind of coming back to you on that point, Robin, I wonder when you'd got that second opinion and you were given that much more, I guess, balanced view of active surveillance versus active treatment, how much detail were you given around that follow-up protocol and what that kind of longer term life on active surveillance would look like?
Well, I was given, I was told how it would work. I was told that I'd have regular PSA tests. I was told that I would have periodic scans, and this was back in 2006, and that I would have probably biopsies every 2 years. Obviously, as time went on, and with the advent of multiparametric MRIs, the need for multiple or for biopsies subsided somewhat. I was extremely satisfied with the advice that I was being given. My oncologist was aware that I was interested in the medical side of things, and in fact, he even sent me some papers on active surveillance that he had been involved in. I was very well given plenty of information in a very easy way for me to understand, and I was very happy that I would not be having surgery, and it would not interfere with either my life or indeed my lifestyle.
Fantastic. Thank you, Robin. We know that when men move on to the active surveillance pathway, particularly in the early months of that, even when they've been given a lot of that detail and reassurance, there can still be a lot of stress and anxiety around, having made that decision not to have active treatment. And especially when it comes to follow-up and retesting. So maybe coming back to you, Anthony, when you were on active surveillance, when you were coming up for tests, did you experience kind of anxiety in the run-up to those? And how did your doctor or nurse help you through that? Were there any kind of interventions that helped you to feel a little bit more in control of the process?
Well, I had taken early retirement, but I was still doing work and other bits and pieces. So it's always nice to have things outside of, that can distract you, for want of a better word. So I think what it was I simply knew these appointments were coming up. But what they did do was, because of, and in a way, the reassurance of getting these letters and getting the calls from the hospital and the emails and the text, actually, I felt as if at least I was being followed up properly. So that was reassuring. And then when I went to the appointments, I obviously had to take, I was notified to take make sure I had my PSA results beforehand, etc. I think the only thing that maybe changed was as time went by when I was on active surveillance, and I then, my PSA began to rise a little bit, which meant that I had to have further biopsies in order to sort of determine what was happening, and more MRI scans to determine if I needed other treatment. I think, again, I was always reassured by the consultants who I saw what was happening at each stage. So they would tell me, look, your PSA's now done this, or, we can see that things may be moving in this direction. It might be advisable for you to have another biopsy so that we can just make sure that the result of this particular PSA, which looks quite high, but is in keeping with your other ones. So in order to eliminate that, we think it might be advisable to do this. So that they were constantly sort of giving me feedback. And it wasn't just, I felt, a tick box exercise. I wasn't just going in there and they were saying, okay, here's a blood test, the results of this, fine. I was always seeing a consultant, which gave me a reassurance. And I'm not saying by me seeing a nurse or somebody else, that would make it lesser, but for me, it just showed the importance of my follow-up. So all of those points led me to sort of feel comforted, or at least some sort of level of comfort when I went for the actual appointments, and for them to explain to me how things were progressing, or if they weren't, as the case may be.
That's great. It's great to hear that clarity of communication that you had at the treatment decision-making stage was carried through into the active surveillance pathway itself. Robin, how about you? What was it like for you in terms of the potential stress and anxiety in the run-up to testing, and how did your healthcare team help you through that?
Well, I have to say that I did have stress before I was having my PSA tests and scans. One reason I think for this was that one of the biopsies made my PSA jump up to, I think, about 32 or something, which was actually an infection. And after this, obviously, I had some drug treatment for this. But after that, it remained relatively calm in relation to my readings. And in fact, for many years, for 13 years, it remained, the PSA levels remained low. and the scans remained good. So such anxieties I had subsided quite considerably.
Thank you, Robin. So we're going to move on to talk about switching to treatment after active surveillance, which we know is often the endpoint for a lot of men on active surveillance, or the next stage. So both of you have now since received active treatment, because obviously your test results showed that the cancer was starting to progress. So we're going to talk about again what you kind of were thinking and feeling at that stage, and how communication from your healthcare professionals helped. So coming back to you, Anthony, what was it like for you when you were told that your cancer was progressing, that you needed active treatment? What support were you offered, and how was everything communicated to you?
Well, what happened was that I had another biopsy, and the biopsy results, I went to see a consultant afterwards in Sidcup, and what the consultant outlined to me was that even though my condition was still in a stage where I could remain on active surveillance, he identified that some of the cells that they had looked into were progressing, and had actually, were progressing in a way whereby he felt that there were other options available to me while I was still in a very low state. And he then explained what those options were, from radioactivity to chemo to brachytherapy. And he then went through what the different outcomes would be, and what the procedures entailed. He explained in great detail, in relation to my age and all the rest of it. So again, there's that initial sort of numbness of not really understanding some of the terminologies, because you hear about things like radiotherapy and chemo, or you hear about, I think my wife had mentioned to me, avoid at all costs having your prostate removed because of potential complications that can happen as a result. So all of these things, are sort of running through your mind, but at the same time, you're still a little bit numb, because, the consultant is presenting to you options that you're not familiar with. So he did a very good job in articulating what the options were and how they would affect me. And he gave me quite a bit of material to review and take away and read that I could follow up on. And again, even though I had some good information that was provided to me, I still did some initial research on the internet to look up what these particular treatments were, in particular brachytherapy, which I'd never heard of before, and I was told was a one-time only option for people who had quite localized prostate cancer. So I think the consultant did a good job in reassuring me, and not sort of creating a sense of panic that I was about to sort of meet my maker, and for want of a better word, and that there were options open, and that these were they, and I should go away first and look at them, and then determine whether or not I wanted to proceed with any of them, or if I wanted to continue on active surveillance, given the information that he'd presented to me.
That's great. And off the back of all of that really clear information, do you mind if I ask what treatment option you chose in the end, and why?
Yeah, so the treatment option that I chose at the end was to have the brachytherapy. And the main reason why I chose that was I was told that it had a 90, I think from memory, either a 90 or 95% success rate in clearing the prostate cancer completely, and that it was an option that you could only have if the condition was very localized and was at a sort of very low level in terms of how the disease was. And I felt that rather than continuing to either go and have more active surveillance and wait for things to change any further, or the radiotherapy option, which I think involved a sort of, I wouldn't call it a scattergun approach, but one where it's not as targeted as the brachytherapy was explained to me. And also, I quite like the fact that it was a one-time only treatment, that, once it's done, you possibly don't need to have any other treatment again. So once I weighed up the pros and cons of that, and then also, fortunately, my wife's friend, who's also a nurse, she happens to work in the department where the brachytherapy procedures are carried out in Guy's Hospital, and she reassured me and mentioned to my wife that it was most men had a very good success rate from it, and etc. So all of that made me go with the brachytherapy option.
Fantastic. Thank you, Anthony. Robin, when you were told that your cancer was progressing and that you needed treatment, how did that make you think, feel, and how important was communication again from your healthcare team then?
Well, the first point is that I had gone 13 years with very stable results and no thought of having to have any further treatment. In fact, I thought I would probably die without having to have treatment. So it did come certainly as a shock. And because of that, I was clearly quite concerned and a little bit stressed. One of the thoughts that kept on going through my mind was, should I have had prostatectomy all those 13 years before? But I was reassured by my oncologist that my situation was no more risky if I had the treatment. And I was offered, in fact, 3 options. The first one, I was then 74, but I'm reasonably fit. They were still prepared to do prostatectomy then. That was one option. The second option was radiotherapy. And the third option was a relatively new treatment, which is called HIFU, high intensity focused ultrasound, which means that through that treatment, there is no actual contact with the prostate. It goes, beams are really beamed through my back passage, and it's non-invasive, and the results were good. The studies had given good results. It was less invasive and less side effects than the other 2. And this seemed to me to be the natural choice to make.
That's great. Thank you. And it's really interesting that you make that point, that having been on active surveillance so long, a really helpful frame of reference for you actually was your current situation versus where you were 13 years ago. You know, that's quite an interesting way of kind of drawing it all together. So thank you for that. Right, we're just going to move on then, just finally, to some quick take-home messages. So Anthony, I'll come to you first. Just overall, how do you feel active surveillance has benefited you, and what would be your one take-home message to healthcare professionals attending this event?
Well, I think active surveillance I felt for me, it worked really well because I think the consultant at the time explained why I was going on active surveillance. I think the reassurance around the proactive follow-ups and the notifications around, in terms of just getting emails and text messages to say what's going on. When I went to the appointments, the sort of fact that I actually was seeing a consultant who, explained to me what the readings were from my PSAs, what it, or the MRIs or the biopsies that I was having. And, all of those things combined with the active surveillance enabled me to sort of just live a normal life, if I'm honest. And I think that the key takeaway for I would like to give for clinicians is what has really helped me right from the get-go was the initial meeting I had with the consultant, who explained to me at the time when I was diagnosed that 20% of men had this level of prostate cancer and that it didn't actually go on to do anything. So those words probably stuck with me all the years that I've actually been on active surveillance, and then led up to my treatment, and then actually had the brachytherapy and all the rest of it. It was just the reassurance I had back then that 20% of men had this condition, and it didn't lead to any sort of life-changing outcomes or death. So the active surveillance for me proved to be very beneficial. It gave me the reassurance, gave me the confidence, and enabled me to sort of continue living my life in a normal way without having to worry that I needed to follow up with the hospitals or anything like that.
Thank you. And Robin, for you, how has active surveillance benefited you in the round, and what's your take-home message for clinicians?
I have to say, like Anthony, I'm a fan of active surveillance. It has enabled me to have 13 years without any treatment, no interruption to my life, confidence that if I did have a problem, if it did reappear, that my treatment would be prompt and effective. And I think another factor which is quite interesting is that because 13 years have gone by on my active surveillance, The treatment, well, the diagnoses, also the biopsies have improved, and new treatments such as HIFU was not available early on. And I'm successfully treated with that. I'm being monitored. So in a sense, I'm back on a different type of active surveillance, but I'm with the same oncologist. And I'm confident that, please God, I'm going to die with prostate cancer rather than from it.
Thank you so much, Robin. And a huge thank you to both of you, of course, for sharing your stories with us.